So the next section will be a speech by a member of the Immigration Department, but unfortunately, as the member of Immigration Department cannot come today, so we will have our speaker to read the speech in place of him.
Why? Because our representative from the Immigration Department couldn't be here, so one of our members will be giving the speech instead. Have given the speech instead. So at this current stage, even Chinese citizens have acknowledged that it is reasonable for Hong Kong to seal its borders. On top of the government's refusal to close borders, it has proceeded to unleash patients north of the border into Hong Kong through the hands of the Department of Health, in front of Hong Kong Communist government's political responsibility to answer to Beijing. Science and facts have to step aside. We can be sure that disease control at checkpoints is non-existent, as demonstrated from the picture shown earlier. And the reasons why this is the case are detailed below. First of all, under current immigration procedures, it is the Department of Health's job to collect health declaration forms. As we've seen, they're extremely loose, simplistic, and a voluntary form which does nothing to ensure or verify their disease status. Immigration officers have no way of finding out about the health conditions of arriving visitors themselves. In the meantime, the Department of Health would take the patients away for further checkups if needs be. The lack of transparency of this operation means that no immigration officers will know if any of these cases are then led into Hong Kong. Officers could have already come into touch with these persons who showed no symptoms and yet passed by the Deputy Department of Health. Usually, the Immigration Office will grant or deny entry to travelers based on certain criteria and existing records of voluntary reports made by the person in the past. The normal practice is that the patients themselves, and not the Department of Health, who have to put in the request for medical help, and then be admitted into the nearest hospital to their port of entry, and not being sent into downtown, with the assistance of immigration officers. But it is now that case that if a visitor is to be denied entry for demonstrating symptoms, the Department of Health will step in and insist on allowing them through to receive treatment at local hospitals on so-called humanitarian grounds. This is procedurally undue. According to past practice, the immigration officer is supposed to deport the patients back to their last port of entry. As to whether or not the patient will be admitted into a hospital, the usual practice will be an immediate admission to the nearest hospital, and there are plenty near the border without having to send them into downtown if need arises. Even if they are to be treated in Hong Kong, it should be the Immigration Department's job to escort patients into the hospital for coronavirus screening. If the result is positive, then they'll be kept for treatment in Hong Kong. Otherwise, they'll be deported back to their home countries. However, the practice now is that the Department of Health will suggest granting them visas for entry and remain and hire an ambulance to transport them to the hospital before informing immigration of the result of the pathology test. Not to mention that all medical expenses incurred during this process are buy now, pay later, and thus easy to elude, an impending medical crisis for our system. Additionally, whether a visitor is considered pathological is determined using a checklist. Both high temperatures and previous visits to Wuhan will need to coincide for someone to be classified as a risk. Since when does the Department of Health have the authority to override Immigration Department? Is this another example of placing political considerations above public health? Why is it that the Department of Health are the first points of contact with potential carriers of the virus, and yet they're not given adequate protective equipment? The second issue is the lack of disease prevention supplies for frontline immigration officers. Ever since the first confirmed case was brought to light, the authority has yet to arrange checkups for officers who handle the immigration procedures for confirmed patients. Nor have they been put on the watch list. The well-being of immigration officers is completely disregarded. At the same time, frontline officers who are put in close contact with visitors are only equipped with ordinary surgical masks, not the N95s. A whole warehouse full of hand sanitizers manufactured in 2016-2017 are currently locked up at the Lok Ma Chau warehouse. Frontline officers are not even given expired sanitizers by the authority. All that the leadership has promised to do is to wipe down the services of the immigration counters with mere disinfectants irregularly. There is already a female colleague of theirs from the Hong Kong Zhuhai Macau checkpoint admitted into the isolation wards. Is it that the lives of civil servants mean nothing to the government? what will be necessary for them to finally close the borders and ensure the safety of our immigration officers? Thank you.